Seeing right at the outset of the pandemic on the news, people coming off the shift and literally just breaking down with grief and angst and anxiety.
We often don't stop to think about, what do our healthcare workers need? Even heroes need support.
Welcome back to Healthy Communities News. I'm Hilary Russo. This pandemic year has been filled with loss and grief and anxiety for all of us. But perhaps no group has had more to process than healthcare workers. While the early days of the crisis saw lots of public displays of appreciation for caregivers, privately, many of them were suffering.
You had healthcare workers that were handling unbelievable uncertainty and workload and stress. Many of them have done numerous rounds of isolation from their spouse, their children, their parents. They were going to work and they were meeting the needs of their patients, and yet they weren't taking care of themselves.
When the pandemic hit, I knew that the mental health effects were going to be a tsunami as well, a second underlying pandemic.
Dr. Phelps leads a group called Give an Hour, which was originally started to provide free mental health care to military veterans through a group of volunteer therapists.
I said to our board, I want to take our network and give free care to people who are on the front lines in these hospitals taking care of folks. And I have no idea where I'm going to get the money. I got a call the next day from our partners at Aetna, which is part of CVS Health, and colleagues that I'd worked with there said, Randy, is there any way that Give an Hour would be willing to work with us to give free care to these people?
And I will tell you that it didn't take Give an Hour even 30 seconds to say, yes, absolutely, absolutely.
The service is available to every hospital worker, not only clinicians.
We offer this to the people, the cafeteria workers, the accountants, the clerks, obviously the people on the front lines in the ERs. PTSD is pretty obvious. The other one, though, that is coming to the fore for these folks is what we have learned from the military and veteran population, and that is moral injury. Having to make decisions that really go against your moral fabric. Your work in healthcare is to save lives, not to choose who gets to live and die. So that is a very powerful issue that people are then left with when things kind of calm down.
The service is free, confidential, and easy to access.
Our therapists love this work. They know that this is a new group of heroes, just like they've been treating over the years.
The healthcare community, they've had to be on the whole time. And so they've handled the ups and downs and the loss and grief and pain. And, now we're in this pathway of hope, and they're vaccinating.
Now, a year into it, as people are able to sort of lay down their tools and start to catch their breath, that is when you begin to see the negative effects sort of come to the forefront.
It's that moment of pause where it's so important that we're able to say, and we're here. You are not alone. You don't have to do this alone. And there are resources to help you. I think one of the best outcomes of the pandemic has been the elevation of the mental health conversation. People are talking about mental health, mental well-being, the need for support.
It's not just hospital workers who have felt the mental health effects of the pandemic. It's most of us, and it's up to all of us to help.
We can ask each other, hey, how are you? We can check in. We can reach out. We can also share our own stories.
We need folks to step up and take care of each other. So take stock of your own emotional well-being, inquire gently about that of your loved ones and friends, and step forward and offer to help them find somebody if they need help.
If you or someone you know needs support, here are some resources to consider. While our focus this year has naturally been on physical health, it's important to recognize the impact that COVID-19 has had on our mental health as well. See you next time.